Who do we have here to be seen? Hi, Robert. It's good to see you again. You can just switch your mask for me. And I can take your temperature. Perfect. And I'll get you to room green 1. And if you just have a seat, the nurse will be in right with you. Hi, Robert. It's nice to see you today. So, Robert, I'm going to have you take a seat right up here because I'm going to come on the computer. So, I know it's been 3 months since we last saw you. And I reviewed your chart before your visit today. It looks like we haven't had any phone calls or anything that it's come up that you've contacted the center. So how are you doing? Oh, great. So you've been doing well. I'm glad to hear that. Okay. And are there any questions or concerns that you would like to discuss with me or any of the team members that you are going to see today? No. So you've been doing well. Okay, great. Okay. So the next thing we're going to move to are your medications and what you're taking. So if you could tell me about your Zopanex that you're taking. Okay, so yes, you do take that 2 puffs every day to begin your treatments, and you wait 15 minutes, that is correct, using the spacer to make sure the medication goes where it's supposed to. And then Robert, can you tell me about your Pulmozyme that you do? Okay, yes, yep, that's correct. So you're doing that once a day, when well, increasing to that twice a day through the nebulizer. And I'm glad to hear you're using the proper nebulizer kit, the PARI LC Plus. And then you're storing that in the refrigerator. That's all very important. So great job with that. And then what about your vest, your therapy vest? Okay, perfect. So you're doing that 20 minutes once a day. And it sounds like you're telling me the order of your medications, which is great, because as you know, airway clearance is very important, because as we discuss at the visits, your body does produce thick, sticky mucus, and it's very important for us to thin the mucus with the Pulmozyme, and then with the vest to help cough and get the mucus out of your lungs so you don't get infections or have difficulties. And then as far as your Trikafta, okay, so correct. So you're taking 2 of the orange pills in the morning and 1 blue pill in the evening. The orange pills are associated with the sun rising. The blue pill is our evening pill. And you're taking that correctly. You're taking it with your enzymes and fat-containing food to make sure that it's absorbed properly. And then as far as your treatments go, the medications that we just discussed, if you were to become sick or have any difficulties, of course, we're going to increase all the medications to twice a day, as well as contact the center. Okay, so Robert, I'm going to let the respiratory therapist know that they're all set for you, and they'll be in shortly to get you for your breathing test. Is there any questions? No, you're good. Okay, all right. It was great seeing you, and I will be back in shortly to be checking on you, see how you're doing. So.
Hello, my name is Anna. I'm one of the respiratory therapists here. I'm going to take you across the hall to do a breathing test. Come with me. Alright, Robert, so the first thing you're going to do is you're going to put your mouth right on here, and then you're going to start off just with nice, easy breath. Then I'm going to ask you to give me the biggest and deepest breath ever. You're going to blow it out really fast with one long breath. All right, Robert, you're going to start off just breathing nice and easy. Perfect. Then I'm going to ask you to give me that really big breath in and blast it out. Keep blowing out, keep blowing out, keep blowing out. You're almost there. You're going to blow out for another 3 more seconds. Keep going, keep going. Now, big breath in. Beautiful. Great job. All right, Robert, you did a great job. We're going to go back to the room, and then we'll see your provider now. Great job. Have a good day.
Hey, good afternoon, Robert. Glad you could come in today. So, kind of wrapping up the summer and getting ready for, it's high school this year, huh? So, I'll just finish cleaning this up. But, you kind of excited or nervous about high school? Cool. I'm sure it'll be great, and you know, probably all the friends from your middle school and new friends from other middle schools coming together, so it should be a good time. And find a place to throw this away. Our trash can is missing. I'll just take it when I go. Alright, so I'm just going to take a listen to you. Anything bothering you at all? Is anything hurting? Cool. Any like congestion or cough or anything? That's great. And vest and everything still fits. You're taking care of your airways like you need to. Fantastic. You still going to do the same sport this fall? Perfect. Alright, just going to listen to your heart. Awesome. Nice, last one. Excellent. Really good. Sounds great. Take a look at your tongue. Stick your tongue out at me. Perfect. And take a peek in your nose. Good. Very good. All right. Perfect. We'll have the nurse come in and go through the checkout instructions. We'll make sure you've got all the letters you need for any of the medicines you might need to take if you have to take any at school. But just I hope you have a great start this fall. I'm glad you had a great summer and been healthy.
Hey, my turn?
Oh yes.
Fantastic, thank you, Dr. Morton. Hi, Robert. My name is Kim. I'm the social worker. You may or may not remember me. We meet every year. It's so nice to see you. I know sometimes it's nice to be without your parents, so I'm wondering if there might be things you might like to talk about today since they're not here. So, if not, I'm looking forward to hearing how high school goes. Maybe you're nervous about that and that change from middle school and new friends who might not know about your cystic fibrosis. But I know you've been comfortable telling people in the past, but I know high school is a little bit different. So you might remember that I offered to you the mental health screen, and I wanted to ask if you would do it today as well. So as you might recall, this one has some questions about anxiety, and the other one has questions about depression. And so we do this once a year because we find that patients who are anxious or depressed have a harder time like being motivated to do their treatments and to take their medications. So as you recall, you've done this before, so I just wanted to offer it to you again today. And when you fill it out, we can talk about your scores. Oh, so you're feeling like maybe today isn't the day to fill it out. Well, that's okay. I mean, we can definitely do it the next time you come into clinic. So I'm glad to see you today. And yes, so this is the mental health screen, as I said. So anyway, I'm looking forward to hearing how high school goes. And I think it was really brave of you to come without your mom today. And so I think that the next person will be the dietitian, and she's going to come in and talk with you about how you're doing with your diet. So great, it was awesome to see you, and I'll see you again in 3 months.
Hi, Robert. It's so nice to
excited for school to start up again? Well, that's great. Well, so I'm the dietitian, Becky. We've met a few times before. I'm just coming in to check in, see how you've been doing. How's your appetite been over the last few months? Well, that's really good to hear. Just as a reminder, with cystic fibrosis, you have calorie and protein needs that are a little higher than average. So you do have to make an extra effort to eat your 3 meals a day, to make sure that you're getting lots of snacks in, that you're adding lots of calories into your meals with things like butter, avocado, creams, and gravies, because your weight is beautiful today. We do want to make sure that your BMI remains at the 50th percentile or up. It is correlated with your lung function, so as long as you're sticking in that position, that's great. Let's see here. Have you been managing your own enzymes now that you're 14? Beautiful. That's great. So you even take them yourself at school? Yeah, and you're taking them before all of your meals and all of your snacks. Any GI issues at all, such as some stomach pain, feeling nausea for no reason, diarrhea, constipation, oiliness or greasiness in your stools? No, none of those? Sounds like you are still on a good dose of enzyme. So do you have any questions or concerns for me today? No? Okay. Well, it was so good to see you, and I hope you have a great school year. All right. Have a good one, Robert. Bye-bye.
Hi, Robert. So we're all set with the visit today. You had a great visit. Do you have any questions or concerns for the visit today? No? Okay. All right, great. So I do have your parking, that it's validated for the Krause Hospital parking garage. Let me give you that. And we are going to mail your after visit summary to your family. So that will have everything from the visit today, including any changes we made, any recommendations. Please contact us with any questions or concerns that come up. You will follow up with us in 3 months. And at that time, you'll be due for your annual lab work, your yearly lab work, as well as your chest x-ray and your mental health screening with our social worker. And I think that's it. You had a great visit today. So since you have no questions, concerns, I will walk you to the door. Okay, Robert, and the elevator is right to the right. It was great seeing you as always. We look forward to seeing you, and again, call with any questions or concerns. Okay, take care.